in this PowerPoint, it will be talking about different exercise prescriptions for different groups of people. So an exercise prescription is a specific plan designed for an individual. The plan is fitness-based and related in order to have an impact and purpose. This is done by a fitness or rehabilitation specialist to cater the plan to the individual to make sure it is safe to do certain activities and exercises. With the exercise prescription, there are certain risks that may occur, and these are depending on the health of the client. A large number of the individuals wanting the exercise prescription are low-risk patients. This means that they won't need to have supervision. They would be able to go to the gym or local area to do the specific exercises planned for them. However, some of the individuals can be high-risk patients. For many different reasons, this just means that they would need a specialised physiotherapist and SEM consultants, cardiac or pulmonary rehabilitation as well. So with these groups, there are also individuals in between that spectrum. So this could mean that they need a local exercise referral scheme or even the physiotherapist, GPWSI or level 3 gym instructor. This would all depend on their individual needs and abilities. So for the population, there are generic exercise prescriptions. For adults aged 19 to 64, they should be exercising for 150 minutes at moderate intensity for 10 minutes or more each week, or each day of the week, or even 75 minutes of vigorous activity across the week. So all of adults should also include muscle strengthening activities in their week. This may include yoga, weights, even a daily activity such as carrying the shopping. This can be done at least 2 of the days in the week. So moving on to the contraindications. Contraindications are a medical or physical condition which can affect their performance during exercise, as well as cause risk and harm to themselves. There are 2 different types of contraindications, absolute and relative. Absolute contraindications mean that if you have one of the following, you won't be able to do any exercise testing. Some of these contraindications include history of recent heart attack, heart-related diseases, severe infections and fever, severe illnesses, or emotional distress. All of these factors could result in serious repercussions if participating in exercise. Relative contraindications, however, means that the individual's condition is still dangerous, but you can participate in exercise under professional supervision. These conditions may include previous history of heart illnesses, high blood pressure, liver disease, advanced pregnancy, and skeletal or neuromuscular disorders, so back problems. Starting with the first group of individuals, so this is pregnancy. So pregnancy is a contraindication in itself, depending on what trimester you're in, but with pregnancy there are common contraindications that can follow throughout the different trimesters. This also means that the exercises that you do need to change throughout your pregnancy. The contraindications that could also occur may be high blood pressure, dilated aorta, arthritis, cardiac diseases, or bleeding during the trimesters. So obviously these will all depend on the individuals, their age, active level, as well as family history of illness. So focusing on pregnancy overall as a contraindication, there are certain exercises that they just shouldn't do. These would include anything that may harm the mother or the baby, anything that may cause injury to both of them. So these exercises include back exercises. These can stop the blood flow to the baby, meaning they aren't getting enough oxygen and nutrition to survive. Therefore, things such as crunches, bench press would need to be altered. With bench press, instead of laying flat on your back, having it raised will help with the lack of blood flow to the baby. So when you're pregnant, you should also avoid full prone activities, so things including skiing, horse riding, or even contact sports. This is because they have a high risk of knocking your belly, so these should be avoided after the first trimester. Due to your centre of gravity changing, it can make balancing harder, so cycling should be avoided unless stationary. as well as exercising at high altitude, because unless your body has already adapted to it, it can reduce the oxygen supply to the baby. However, the exercises that are recommended for pregnant women are yoga, Pilates, like low weight exercises, water sports, and even walking. These are all moderate or low intensity exercises, which means you aren't overexerting your body. Pregnant women are recommended to do exercise at least 3 to 4 times a week, if not so, exercise each day. The session should consist of working at 65 to 75% of your maximum heart rate, or even 7 to 8 on the RPE scale. But this will all depend on the woman's activity level beforehand, so the doctor may recommend otherwise. The sessions should be about 30 minutes long each, and they should vary throughout the week of what type of exercises they want to do and include. Moving on to the next group. So for older adults, there are a variety of different contraindications that may occur depending on their age, obviously active level and medical history. Some of the contraindications may be like high blood pressure or even severe hypertension, acute illness, congestive heart failure, severe valvular disease, acute thyroiditis, diabetes, osteoporosis, angina, and maybe any injuries that they currently have. All of these contraindications can have an effect on what they are able to do fitness-wise. There are certain exercises that other adults shouldn't do, and these may be high-strength training. So working with heavy weights may make their bones more brittle, therefore starting with low weights more frequently will help strengthen their bones. With strength training, however, they may need to talk to their doctor first to make sure they are able to do certain exercises, so they won't harm themselves. So other exercises like isotonic exercises shouldn't be done because it can resist the blood flow in that area. Generally for older adults, there are certain things that they are able to do. So for older adults, they are recommended to do low to moderate exercises 2 to 3 times a week, working at 55 to 65 maximum heart rate percentage, or 67 on RPE scale. This should be done for 35 to 45 minutes, depending on what their doctor recommended or their fitness level is. The activities that they should be doing include walking, cycling, swimming, yoga, aerobics, and Zumba. However, focusing on if the individual has osteoporosis or joint pain, there are certain things that they are able to do, so they should still do the same frequency, intensity, and time. However, the activities that they should do vary, so swimming or any water activities are better for individuals with osteoporosis or joint pain because the water allows the pressure on the joints to relax because you're not putting too much strain on the muscles. The next group that we'll be looking at is, and the final group, is disability. So for individuals with disabilities, there are certain contraindications that could occur. However, they will vary from the different disabilities. So the contraindications that may occur could be cardiac diseases, hypertension, diabetes, chronic cystics, chronic pain, and arthritis. All of the contraindications may affect individuals with disabilities. With these contraindications, it may mean that they don't try an exercise, which could have an impact on their mental and physical health. When working with individuals with a disability, there are certain exercises that you shouldn't do. These obviously depend on their disability, but the general exercises you shouldn't do is isometric exercises or contractions or anything that can affect their centre of gravity. Due to the fact that there are a variety of different disabilities, I will be focusing on individuals in a wheelchair. So therefore, there are a variety of different ranges of factors that could affect the level of activity. This may be their age, type, ability, whether they've recently been in a wheelchair or been in a wheelchair their whole life. Generally, there are recommended amounts of exercise that they should do. So they should do 3 to 4 times a week, working at 65 to 75% maximum heart rate or 7 to 8 RPE scale. With these exercises, they should vary from 30 to 45 minutes depending on what they are working on. So the types of exercises that would include wheelchair sprinting or a rowing machine, this would need to be adapted in order for someone in a wheelchair to use it. But there are also able to do wheelchair sports and seated exercises that can help with their strength and just independence in general. Also, individuals with other disabilities could also include swimming. People with wheelchairs would be able to do swimming, but they would of course need to be assisted.